Hi, I'm Dr. Michael Brisman, neurosurgeon from New York, and I'm going to be talking to you today about a benign type of brain tumor called acoustic neuroma. The above MRI shows a typical acoustic neuroma right over here. These tumors typically present with decreased hearing and are found on MRI exam. The treatment of choice, in my opinion, for most acoustic neuroma is gamma knife treatment or super-focused radiation treatment. An example of that image is above. People lie in this machine for some 30 to 60 minutes, and these invisible radiation beams all focus on the tumor. This is an example of a patient I treated for acoustic neuroma, and you see the close conformality of the radiation to the tumor and how rapidly the radiation dosage falls off from the tumor. This is an example of a more recent plan where we outline the tumor, and also in blue we outline the cochlea, and we found that keeping the cochlear dose at a certain low enough level is important for hearing preservation. This is a patient of mine that I treated 13 years ago. On the left was a picture of her MRI and the treatment radiation imaging, and the image on the right is 13 years later. The tumor has remained stable and her hearing has remained stable. Above is an image of another patient that I treated with a moderate-sized acoustic neuroma on the left MRI image, and on the right is 6 years later. The tumor is dramatically shrunk. This is an image of a patient with Neurofibromatosis Type 2 who has acoustic neuromas on both sides, and I first treated the tumor on the right side, which is seen on the left image, and as you see on the image on the right side of your screen, the tumor dramatically shrank. I subsequently treated with gamma knife the other tumor as well. In rare instances when tumors are quite large, acoustic neuromas are quite large, I recommend debulking the tumor. As you see above, this was a very large tumor that I took out almost all the tumor, but leaving the portion that stuck to the nerves. This patient, after surgery, had intact facial function and also had complete preservation of her hearing. We then planned to do gamma knife or radiation treatment to the remaining piece. In conclusion, for most acoustic neuromas, gamma knife treatment is the way to go. Very large tumors may need debulking, and some very small tumors or tumors that are stable can probably be safely followed. But for most patients, gamma knife, bloodless brain surgery, outpatient treatment is, I think, the way to go. Thank you.